Good afternoon, everyone. I want to welcome you to our final session of CGI's Week of Action for Resilient Solutions for the Caribbean's Future. You may hear or think you hear small little people in the background, and you are hearing small little people in the background as my children, as I imagine many children in your own lives, are at home, playing at home, hopefully learning from home, and hopefully staying safe. I just really want to thank everyone for being with us throughout the last few days and being with us especially today. As you'll hear from our extraordinary speakers this afternoon, the Caribbean faces many challenges at this moment. Clearly, the COVID-19 pandemic that is affecting every country around the world, and also facing the ravages of climate change that have fallen significantly, substantively, and far too frequently on the Caribbean. I hope, as you will with all of our kind of CGI Action Network events, think about how you and your organizations can be part of building and sustaining a more resilient and certainly a more healthy future for the Caribbean. And we're certainly always here to be part of that thinking and that work with all of you. So now, without kind of any further delay, I'd like to welcome our first speaker today, Dr. Joy St. John. I thankfully am not navigating the technology. Oh, good. So there is thankfully Dr. St. John, that she could kind of bring herself onto the screen, and that wasn't incumbent on me is probably a relief for both of us. So, Dr. St. John, I want to thank you so much for being with us today. And we're incredibly grateful that you're taking time out of your very busy work to join us this afternoon.
I wouldn't have missed this for the world.
Oh, well, thank you. And I think what would maybe be most helpful for our audience who may not know kind of how the Caribbean has been affected by COVID-19 and kind of what's happening today, maybe you could just give us kind of a brief overview of kind of what the current status is.
Well, the first thing I need to do is to thank you and your organization for this opportunity. And the second thing I need to do is to say I'm going to speak about CARICOM, which is mainly English-speaking Caribbean, but we do have Haiti, and we do have Belize, both French and Spanish speaking. So for CARICOM, and I speak in this way because I'm the executive director of the Caribbean Public Health Agency, which is a CARICOM institution. So the CARICOM sub-region of the wider Caribbean has had what I would say is the mother of all challenges. And the way in which the Caribbean has dealt with it is that in a coordinated manner, they first tried to stop importation. And now we are learning to live with COVID-19 safely and also return to economic activity, which is nowhere as easy as saying it is. The Caribbean has had a mixed experience because there are some countries that are right now having real increases in cases. And there are some countries that have not had a case for several weeks. And then there are countries that have had a few cases, but they are under control, systems are not overwhelmed. And so we've categorized to no cases, sporadic cases, clusters of cases, and also community transmission established in the CARICOM region. But even though this is the case, that we've got the mixed bag, the coordination of the way in which the countries are dealing with this remains intact, mainly because of one, the technical interplay of the chief medical officers, the ministerial collaboration, and also the direction of the heads of government as convened by CARICOM. So it has been the mother of all pandemics and the greatest challenge of my career.
And how do you think, Dr. St. John, about preserving that coordination and that kind of the communication and the collaboration that is clearly implied with the coordination? You know, certainly here in the United States, we have not had a coordinated response kind of across, you know, cities or states. And I think what you have been able to kind of help lead has been so remarkable. How do you think about helping sustain that into the future?
Well, first of all, I am helping to support the member states' leadership. But if we don't do this, we'll die, simply. We are countries with very small populations. Even our largest population, Jamaica, 4 million, that's small. So we're countries with small populations, we're under-resourced. Our people are our greatest asset. And if we're not careful and we do not sustain that coordination, the burden of chronic disease will work with COVID-19, and it will take more people than you would traditionally think, the older people, because we've been seeing some young people, young as in under 50, young people, and even some children, unfortunately, but with underlying conditions, they have died. So for me, it is critical. I have sustained as much as possible that coordination. I like to think of CARFA as the glue that's keeping things going, and not just in health, with other sectors.
You just were mentioning, you know, other sectors, Dr. St. John, and I know last week there was a big announcement across the region with travel and tourism. Could you talk about that a little bit?
So the bubble.
The bubble, yes.
So there have been countries that have described countries and circumstances under which they can travel without using testing. But it's been different among the countries in CARICOM. But what the heads of government did is that they asked CARFA to develop criteria, which we presented to them. They gave us 2 days and we did it. And then they came together to agree on the criteria and countries that would be within the bubble. So this bubble for me is perhaps going to be our best way to sustain going back to tourism as a livelihood, because you know it's one of the most, if not the most, tourism dependent sub-region. It's the way that we're going to be able to go back to our economic activity and still preserve lives, both of citizens and visitors. So for me, the bubble, if we can stick to the criteria, and CARFA will support the countries, is the way to go.
And, you know, thinking about the bubble and clearly, like, part of what I think will be so important to ensure kind of the bubble is kind of continued testing, is kind of continued monitoring of COVID-19 levels. Can you just talk a little bit about how you're going to help coordinate that across the countries to ensure that the countries are doing enough testing and testing enough of kind of different people in different places, so you have a good sense of whether there is community transmission or not?
So CARFA has been supporting not only with testing, and at first not every country had the capacity. So we were doing primary testing for a lot of the countries. But we've been supporting also with testing protocols. And these have been faithful to WHO. But recently, we've kind of parted ways, because for us, in this stage of the pandemic that the CARICOM is, even with the countries that are having spikes in cases, we don't have the level of positivity in our populations, which would allow us to switch to rapid antigen or rapid antibody testing. So we have suggested always that it should be PCR as a gold standard. The other thing about the testing is that we have tried to also stick with who should be tested. Now, WHO has more or less stuck to certain case definitions, et cetera. We have kept up with that. We're not saying that there isn't a place for antibody and antigen testing, but when you don't have a lot of transmission, you need to be sure that you're actively diagnosing active disease and not looking for past disease, which is where we are with antigen and antibody. The other thing is that the sensitivity and specificity of the testing is critical so that you don't have false negative. You've got a negative from a rapid test, walking around and spreading infection, because we've seen a lot. This is what was said from the start. We've seen a lot of asymptomatic people who test positive. So the testing, there is the testing for diagnosis because you've got active disease. There's the testing for contact tracing so that you, if you detect a case, you ensure that you wall it off and control it and don't overwhelm the services. And then there's the testing for travel, which is something that we're coming to grips with because PCR is a gold standard and it's golden in its price. So it is difficult to maintain. So the ways in which we get the testing done, not only in the CARICOM region, but also before people come into the region. So testing, PCR, 72 hours before travel, that is what we have recommended also as part of the constructs around making the bubble work.
Yes.
For those countries that do have, for example, borders with countries where there's uncontrolled outbreaks and there's a lot of migration, the rapid test, antigen or antibody, once it has high sensitivity and specificity, it has a place.
And Dr. St. John, how do you think this will change, or will it change, like healthcare and public health in the Caribbean going forward?
It's not just healthcare and public health.
No.
It's every aspect of life, but start with healthcare, stick with healthcare. The first thing is that there has to be the understanding of doing your work safely and also making sure that your health services are also healthy. So the measures you have for ensuring that there is no illness or spread of illness. For example, at CARFA, we've had a series of measures and we are also testing our lab staff regularly because they are working so hard on keeping the understanding of what is the issue with COVID-19 and its spread in the countries. So there is also with the health services the understanding that in executing their tasks and going out in the field or going to certain businesses, there are certain protocols that they should look for to ensure that the businesses are also compliant. So there is a due diligence that the health services can provide, as well as ensuring that when they interact, they are following protocols. But one of the major things is getting back to NCDs and the risk factors, obesity and smoking. There is the need for strengthening, and where a program was strong, maintaining the strength of the program and the reach of the program to ensure that we keep NCDs under control and keep preventing people from becoming NCD positive. And also, of course, we're in the hurricane season, and because of the rain, we're in the vector and dengue season. And so we have to have vigilance for anything that could promote either negative outfall if we have an event like a hurricane or even flooding, and also to look out for dengue and to try to do the source reduction, et cetera, et cetera. So for me, you will hear that health is not just the clinical medicine, it is also public health, it's also environmental health.
Just, Dr. St. John, in our last minute, like what would you like to see from the international community, kind of whether from the kind of conventional international development side or from kind of nonprofit or private sector partners?
So first with IDPs and also the lending institutions, I want there to be equity in how the financial ratings of countries is going to be changed. Because first and foremost, if we do not find a way to keep our economies going, the fallout, it isn't just going to be an issue of the Caribbean. There will be a ripple effect all over. So we have to have equity in how countries are categorized and what access they have to funding, et cetera, et cetera. For the development partners, I want them to continue to support in the way that they have been. We have had amazing support. I will talk about the health sector. We have had amazing support from the EU, from the World Bank, from IDB, from CDC. And the support has been not just about testing. The support has been about capacity building for health security, maintaining and strengthening systems for health security. We need more of that. And then we have to look at the issue of the treatments which are approved and also the vaccines which will be approved. And we want to be able to access them equitably. And this issue of access and having a seat at the table and a voice when the goodies are sharing, this is something that we've been hammering in the CARICOM region.
Well, Dr. St. John, thank you so much for your time today and for sharing your insights and your views. I could not agree more that we need to have equitable access to the vaccine or vaccines once they're proven at scale, safe and effective. I wish the United States were part of COVAX and think it's really tragic that we're not. And certainly, hope that all of us who are part of this conversation today can do whatever we can to kind of ensure that equitable access is core to how we think about vaccine distribution once we have a vaccine. So just thank you so much.
Thank you.
Virtual applause. And I think now, oh, I think Dr. Gordon is joining us next. Oh, yes. You're on mute, Dr. Gordon. Oh, good. You have even more books behind you than I have behind me.
Well, I was thinking, I kind of looked at you and I thought, well, is she in my home? Because it looks very similar.
You have like books on two sides. I mean, we have more important things to talk about than bookshelves. But as someone who loves books so much, it is one of the joys, and I do think we have to find a joy in this awful moment that we're living through together wherever we can. It is very joyful to see so many bookshelves and so many Zoom shots, and you have a particularly good one.
Thank you. And for me too, to see yours.
Oh, good. Well, thank you so much, Dr. Gordon, for being with us. And I really am so grateful for your time today. And we're living in this kind of collision of so many crises at the moment. And when we think about the long-term effects that COVID-19 will have on, if you can hear my children in the background, who haven't, seen their friends or their cousins beyond kind of a screen like what we're sharing now. Or I think about my son Jasper, who has now spent half his life in quarantine or kind of sheltering at home. You may hear him in the background. He's saying "mama." It was his first word. It's something else I take joy in this moment. Could you just, especially kind of given your life's work and your areas of focus, before we kind of dive into more specific conversation, I would just love to hear your general advice for how we think about kind of living in this uncertainty, living under this COVID-19 cloud, and how we think about navigating forward over probably still quite a long horizon of uncertainty.
Well, thank you for asking. I think the first thing is to do exactly what you just did, is to remind ourselves that we are living in the midst of a pandemic, that we're facing terrible climate-related disasters, and not just in the Caribbean, here in the United States now, in the continental United States, and that all of us are affected, and that we're in as you know, I've been working with population-wide psychological trauma for 30 years, and what I see here in the United States is not so different from what I've seen in post-war situations or situations after major climate-related disasters, is people are in a tense state. We're anxious with each other, a little more irritable, maybe have a little more difficulty sleeping or concentrating. So the first thing is we need to accept that, to recognize it, and to begin to use some of the very simple self-care techniques, like reminding ourselves to breathe deeply. Like right now, just to kind of come into balance. Because when we're called upon to do things, in addition to all the stress that's around us,
I just realized I don't think I'd taken a deep breath all day. You said that and I was like, oh, I don't think I've done that today. And it's 2:30 almost. Sorry, I interrupted you, though, Dr. Gordon. You
so
were
now's the time to
give
do
us
deep
advice.
breaths in through the nose and out through the mouth with our bellies soft and relaxed. Just coming into this place. And as we do that, that's the antidote to the fight or flight response, the antidote to the stress response. So our body and our mind comes back into physiological and psychological balance, and it's easier to do with all the stresses that are around us. Second piece is to move our bodies. I mean, this is a beautiful way. For example, physical exercise and movement may be the single best treatment for depression, and it's great for anxiety and it's great for sleeping problems. So we need to remember to move around. We need to reach out to other people. Population-wide trauma healing happens when people come together and share with each other and be as vulnerable as they're willing to be with each other to talk about what's happening. And then those are the basics. And then a fourth thing is to find something to do that is meaningful and purposeful to you during this time.
And, kind of, I think building on the last two kind of things that you just spoke about, could you talk about the commitment to action that you made and kind of where you are, kind of what progress you've made? Because I think that speaks directly to kind of what you were just reflecting on is good for all of us to be mindful of in this moment.
Sure, very happy to. And thank you, Chelsea. Thank you for having me here. And I want to thank Becca Curtis-Held and Greg Milne and all of CGI, really. You've been supportive of our work, not only in Puerto Rico, which I'm going to talk about in a moment, but also in Haiti over the years. So I look forward to exploring all the ways we can move together. So as you heard, everyone, my name's Jim Gordon. I'm a psychiatrist, and I'm the founder and executive director of the nonprofit 30-year-old Center for Mind-Body Medicine. We're located here in Washington, D.C., and we work all over the United States and all around the world. 20 years ago, I was appointed by President Clinton to chair the White House Commission on Complementary and Alternative Medicine Policy. For the last 3 years, my CMBM, Center for Mind-Body Medicine colleagues and I have brought our program of population-wide trauma healing to Puerto Rico. The 81 Puerto Rican educators, healthcare providers, and community leaders that we've trained are now implementing a model of community-wide trauma relief and resiliency building, a model of self-care and group support in regions of the South in Puerto Rico that were devastated by the 2020 earthquake, while continuing to work in areas across the island still recovering from Hurricane Maria. And this deeply committed and gifted Puerto Rican team, and I have to say what a joy it has been to work with people in Puerto Rico. We go very deep, there are a lot of tears, but there's also a lot of laughter and a lot of sense of purpose and hope. And this team has successfully provided self-care skills and group support to over 4,000 seriously traumatized children and adults. Together with our partners, which include the Veterans Administration, ASMA, which is the Mental Health and Addiction Services Administration, Accuden, Head Start, Early Head Start, Project Launch, Ponce Health Services University, and Fundacional Stefano. We're moving into the next stage of our commitment. And we are hoping within this next year to work with 25,000 additional children and adults. And we're very much looking for funds to support that work. And these people include families in earthquake-affected cities, Guanica, Guayanilla, and forgive my pronunciation, and Ponce, as well as those across the island who have been severely affected, as so many have, by the COVID-19 pandemic. We're also exploring the possibility of working with our partners and any other partners who would like to join with us to make our evidence-based model, which has repeatedly been demonstrated to reduce diagnosable post-traumatic stress disorder by 80% or more, the foundation of a sustainable island-wide program of primary mental health care. There really isn't such a thing in Puerto Rico, and the need is very great. And Terry Bischoff and Dennis Rivera's Foundation for a Better Puerto Rico, who brought us to Puerto Rico, the Greater New York Hospital Association, Direct Relief, the Hispanic Federation, the Healthcare Education Project, and Medtronic have already funded our work, and they're our partners, and we hope to have other partners join with them in Puerto Rico. And our program has been warmly welcomed everywhere. And I want to read to you something that Vanessa, who was a woman from the South who participated in one of our groups, a group that was led by one of our Puerto Rican trainees. I want to read what she has to say about her experience in an 8-week-long group. This is just 8 2-hour sessions. And what we'll see is she's not just talking about what happened and how she has developed resilience in the face of the earthquake. She's talking about the healing of a lifetime's trauma in the course of 8 weeks. And what Vanessa said is, continuous violence in the home since before I was born, deaths in the family nucleus, all the stresses afterwards with family members. Add to that all the changes from earthquakes and coronavirus this year, and all that implies, plus everything in between, drove my anxiety into relentless panic attacks. Today, she's talking about after participating in the 8th Mind Body Skills Group, I feel calm and am doing things I couldn't do because they would bring me panic attacks. My finances, home, everything was a real mess. Now my fears have lost their power while my self-esteem gets stronger. This program changed my life completely. And this is what we're seeing. And this, speaking with you all here, this is an invitation for you, Chelsea. I hope you'll come visit us, see what we're doing. But for all those who are watching and listening, if you're interested in learning more about what we're doing, please contact me. It's jgordon, Gordon, at cmbn.org, or look at our website, cmbm.org, or do both. So again, thank you for letting me be here and encouraging us in doing this work and giving me the opportunity to share it.
Well, Dr. Gordon, thank you so much for being with us today, and even more, thank you for everything you're doing. And I hope that more than a few people who are with us this afternoon take you up on your offer to reach out and to learn more, and hopefully to become engaged. So just a tremendous amount of thank you to you.
Thank you, Chelsea.
Thank you. Thank you. Stay safe. Right. And I think we're now transitioning to our next conversation. And again, I'm so thankful that it's not my responsibility to kind of ensure that everyone is kind of in space together. I think you're also hearing my son Jasper, who's quite vocal. He has so much to say, even if he can only, at the moment, say 3 words. So if he interrupts us at some point, I'm just apologizing on, well, I guess really my behalf, since I'm his mom, and ask for your patience and your forbearance. I'm really excited about our next conversation, and I don't know if we're all in the same kind of arrangement on your screen, but I think, you know, since we are largely going to focus on COVID and related issues. And I see Juliet next to me. I don't know where she is on your screen, but maybe Juliet, you could begin and introduce yourself and kind of give a brief status update on COVID-19 in kind of your community and your work, and then I'll go at least in the order of the boxes that I see on my screen. And apologies if that's not the order of the boxes that you see on your respective screens. Julie.
Thank you very much.
Thank you.
Thank you very much, Chelsea Clinton. Thank you for having us. It's really a pleasure to speak to you, Chelsea, if you don't mind me calling you that.
Oh, please. Admittedly, I think in this moment of COVID, we have to have, I hope, kind of less formality. I think we have to find ways to feel connected to each other, even in this virtual space. So yes, please call me Chelsea.
Yes, thank you. And to all of the fellow panelists and listeners, I'm Juliet Bino Sutherland. I'm the executive chair of the Queen Elizabeth Hospital. That is the National Hospital in Barbados. Barbados is part of the Caribbean subregion that Dr. St. John would have spoken about earlier, and we really are part of the CARICOM grouping and very much benefit and led by CARFA and its coordinated response across the region. And I want to thank her for her leadership in that regard. As a country, we have fared relatively well. We've had to date 189 confirmed cases, 102 females, 87 males. And we've had a very aggressive testing campaign. I think we've done more testing than many countries are per population size, with about 21,972 tests conducted to date. So we are, for the size of our population, we're pretty pleased with our response, but we're not complacent. We recognize that COVID is a disease that we are still learning a lot about it. The hospital has been at the forefront of the national response. We have been responsible. We've been given a national mandate to keep our lone national hospital COVID-free, given the early experiences we saw happening in Italy, China, New York. We've given a very clear mandate because of our coordinated response to keep our lone hospital free. And as a result, new facilities were built to keep COVID positive patients adequately tested and treated. So that's the key lesson from the Barbados experience. So I'll pause there just to let others speak, but to say to you, here in Barbados, we really have benefited from the importance of national, regional, and national coordination, having a very clear governance structure, clear mandates that devolve down, and clear sources of information, one source of communication. And that level of governance and coordination has really done our country particularly well. It therefore left me to really focus in as an implementation partner on carrying out the mandate that was given to me. And as we talk more on this call, I really focus more on how we achieved the status of having no patients or staff contracted COVID, and maintaining high levels of PPE security when others around the world had been struggling. So we have, although we're small a country, we have large lessons to share.
So thank you. I think I'm very eager to hear about those lessons, and I'm also very jealous. I say as an American, it really, good governance and leadership really matter as we are living kind of with the consequences of not that at the moment. So I think, Maria, you're next on my screen, and I think that's probably, sadly, a good transition to you. Could you talk a little bit about kind of what has been the experience and is the experience right now in Puerto Rico, kind of with COVID-19?
So hi, my name is Maria Levis, and I'm the CEO of Impactivo. Impactivo is a social impact consulting firm, and what we do is empower leaders with data and tools to implement and fund evidence-based practices that improve patient outcomes. So we have been very present in all of the natural disasters and other public health emergencies we've had over the years. With respect to COVID-19, Puerto Rico started with strong control. Unfortunately, we now have over 40,000 cases and over 600 deaths. 75 of those were in the last 10 days. So we're not only seeing a significant increase in COVID-19 deaths on the island, the Centers for Disease Control has also started reporting excess mortality from other diseases that are not COVID. A lot of them patients who are coming into the emergency rooms with deteriorated chronic conditions. At Impactivo, we know data is crucial. So we've been gathering data on the population post-pandemic. And what we found is that over 79% of the population lives with someone who they consider at high risk for severe COVID-19 disease. So that is a strong implication both for the health sector as well as how we will control this and for the economy. And a lot of what we're seeing for the economy is related to that. Also, 47% don't know how to address other health conditions during the pandemic. And for Medicaid patients, 30% are already reporting that their health status was worse than last year. 52% have already experienced limited care, access to care over the pandemic. So let's be very clear, with respect to the population and the general population, 24% understand that an office visit, a traditional office visit, is not what would be useful at this moment. However, only 6% have used telehealth, right? So this is a very small group. And 68% of the population wouldn't even know how to access a telehealth visit at the moment. The good news is 98% of the population, and this is across all age groups, is interested in telehealth options. So the population is interested. There's a lot we need to do before this becomes a reality. So 28% express that they need support to engage with telehealth, and those supports need to be broad, not just support with technology. A lot needs to be done on social determinants of health and the economy. 38% of people are reporting reduced income. 50% are concerned that they will be losing their homes, right? And this is particularly with a Medicaid subset. And 30% have had to limit their food because they couldn't afford it. So it comes to no surprise that 54% are experiencing sadness, depression, or hopelessness. So Dr. Gordon, I really support the work that you're doing on the island and interested in figuring out how we can support. So all this to say thank you so much to the Foundation for holding this important discussion so that we can figure out how to have further action. And thank you for inviting me.
Thank you, Maria. And Milagros, I don't know what you would like to add kind of from your perspective in Puerto Rico. And then really hope we can, talk about the lessons certainly that Juliet spoke about that she has, I think, been a part of creating, but also really kind of Maria picking up on what you said, kind of what more can and must we all be doing, and how can this community support you. But Milagros, really would appreciate you kind of talking about your work and then sharing your perspective on Puerto Rico.
Hi, my name is Milagros Mendez, and I'm the acting chair of the Department of Psychology at the University of Puerto Rico. and also the principal proponent for a project called Patria, which is a project that was developed to address the mental health needs of people affected by Hurricane Maria. Uh, and this is a project that is possible with the collaboration of the Hispanic Federation. Um, in From what Maria has been saying, basically it's all correct. So I had also the numbers to give you, but I'm not going to go into it. The only thing that I do want to add is that the governor of Puerto Rico put together a task force to help her make decisions over the COVID-19. Um, but that task force is basically, it's what was or is, I don't know anymore, integrated by people from the medical science and from the economic background professionals. But that task force did not have any professionals from the mental health uh, um, area. So it didn't have that component, the social and the psychological component that I think are very, very important, just as much as it is, the infrastructure or the physical component.
Absolutely. And I think one of the things that was so compelling about kind of when Juliet was talking about kind of what had gone right was that there was kind of such a large collaboration, but real clarity about kind of who was doing what and kind of whose job it was to do what. And, Juliet, I do think it would be helpful to hear you talk about some of the lessons that you want to share from your experience, because clearly not in any way to minimize the suffering of people in your country who got COVID-19 and the grief that kind of was experienced. You have done disproportionately well in managing this crisis, kind of on almost any metric. So I'm probably not the only one eager to hear whatever lessons you really have helped kind of create, and kind of what you think could be replicable elsewhere.
Well, yes, in terms of our project, the first thing is that this is a university-based project. So what we wanted to do was to have a cadre of professionals trained specifically in how to treat people that undergo any natural event. We call it natural event, and we don't call it natural disaster, because we really feel that it is the way that you respond to an event that would be less or more disastrous. So, so what we do is that we came up with a multidiscipline project, meaning that our graduate students from the clinical program, the social work, and the rehabilitation counseling program, we came together to have this project and train our graduate students in how to address the issues in a better way. So in that sense, we wanted to have this cadre of people being trained properly, not just for the hurricane situation, and then of course the earthquake and now the COVID, but for any other natural event that will come across. The other thing important about this program is that we are actually addressing the needs of people across the island, so that we have two other campuses of the university with this program. One campus in the north and one on the south, and then at the Rio Piedras campus, so that people can go and have their needs taken care of. And for those that cannot go to any other campuses, we also provide visits to the houses, so that if people are bedded or they have some kind of functional diversity, that they can, they can be paid a visit by our team. So, and we do that in order to ensure access to mental health services. The other thing that we did is that we actually developed collaborations with 9 community-based organizations. We learned from our experiences, the past experiences with the hurricanes, that community-based organizations were the ones that were able to quickly respond to whatever needs people have. So we paired with them in order to provide services promptly.
And, Juliet, I do want to hear kind of you reflect on the broader lessons, but listening to Maria and Milagros and kind of what you were saying about ensuring that kind of your hospital was kept COVID free. I wonder if you can also talk about how you worked with community organizations to do that, kind of how you thought about kind of telehealth, how you ensured that people were accessing the care kind of where they needed it and when they needed it, while also kind of keeping your hospital facility COVID free. And really, again, any other lessons you want to share, I'm really eager to hear and learn from.
Yes, thank you very much. For us, we recognize we didn't have the luxury, as some territories did, of having more than one hospital. Because of the size of the island, we really have one national hospital. So when you have that, that is a built-in national vulnerability that we determined we had to turn into a national strength. So part of this, which I wanted to share with you, was the importance of leadership at all levels. So leadership, obviously, from the Prime Minister and through to the Minister, clear coordinated leadership. But at the hospital level, we really had to move very quickly into crisis leadership. And there are different leadership models that really were adapted to this. And we quickly, because we're a public sector organization, we quickly had to learn to move from implementation deficit to really an implementation marathon, because we were having to do things very, very quickly in very quick time. So you had to really bring the leadership skills that were required to be able to working on multiple fronts and keeping several teams motivated at a time when fear and anxiety was so prevalent, particularly among healthcare workers. So therefore, partnerships became particularly important. That when we found problems, we recognized that the solutions did not rest just within the walls of the hospital and the expertise that resided here, that we had to look out to the public sector, other public sector agencies, private sector, and NGOs. And in this regard, the private sector played a particularly important role in our national response. We had to quickly identify additional beds, because as you recall, those early days when we were concerned about, ICU beds and monitored beds, we quickly used an innovation called like an option lease agreement, where we got private hospitals to agree basically to take an option lease that we would basically pay them to be on retainer, and should we need their beds, within 24 hours, we can access it. So that was a legal innovation that we had not had before. We also recognized with our nursing leadership that we had to look for our best nurse leaders across the country, and not all of them resided within the hospital. I remember calling ICB, a local major insurer, and I was aware they had a very strong nurse leader, and say, hey, we need some help at the hospital. I called them at 8. By 10 a.m., she was knocking at my door. Hi, Miss Sutherland. So you had to quickly, you had that level of private sector engagement. We had to learn new ways of doing things that we would have thought of and heard of. Most hospitals have a very centralized way of delivering medicines. You come to the hospital pharmacy all around the world. We started repurposing a hotel and food delivery service to deliver critical medications during COVID to people who were on lockdown, and to help them not have to necessarily come into the hospital. So we had a very, very serious engagement with the private sector. Other public sector agencies also came on board: repurposement of schools, utilization of defense forces for field hospitals to provide support to or your accident and emergency services so that you could necessarily protect the hospital from the decision-making process while you were awaiting a test result. You needed to have a place where people who still needed emergency treatment, but you didn't know their status. Essentially, the Defense Force provided a field hospital adjacent to us in our university compound, and we utilized that. So it really was a matter of leadership to identify real-time solutions and quickly go into an implementation marathon. One of the gaps that we saw that still has not been filled was the networking of hospitals across the region. And because we're small islands with limited resources, very often we need things that are large amounts to us, but in the scheme of the world, 3 boxes of a critical medicine are nothing. It's not going to be prioritized, where supply chains and supply routes out of India, China, every place we were looking for are being contracted. And we didn't necessarily have as agile a response across the region to reply to respond to those supply chain challenges for medicine and critical commodities. Lastly, mental health. We had to repurpose. We focused a lot on staff mental health because you were taking already pressurized hospital systems and asking people to do more. So we essentially repurposed our psychiatry department to do mental health triaging with our staff. And what we would find out over time increasingly, that we would have to do a significant amount of work, as was raised earlier by our speakers, with our patients. And it was something that we still considered an area that we need significant strengthening, the mental health of patients. And what we've had to do, a key lessons learned, is dehospitalize. We took a very biomedical model approach to the setting up of isolation center. And here we were having a significant proportion of our patients being asymptomatic, relatively healthy individuals and children in these facilities. We're now recognizing we have to use approaches from hospitality, from tourism, using art therapy, and a whole set of new approaches that we don't necessarily think about when we started the epidemic and how we set up the facility. So basically what we call dehospitalization of our isolation centers to be more centers of wellness that people can recover in a very, very progressive mental health setting. And the last 2 things I want to just add quickly so I don't dominate is we recognize that where health systems were weak or where hospitals were weak, in our case, ICT was a weakness. They didn't disappear overnight because of COVID. So Dr. St. John talked about it earlier, the continued emphasis on health system strengthening and the important role that ICT and telemedicine is going to play going forward. We now are doing a lot more with community outreach, following our vulnerable cardiology, diabetes patients into the community, keeping them in the community using mechanisms that can monitor blood pressures, and doing much more telemedicine, community-oriented medicine that we traditionally had done as a hospital, is really turning the hospital model upside down, where the hospital now is going to become a hub, but the spoke of the hospital is really going to be very much in the home, in other community centers, and partners like our IPPF affiliate or Heart and Stroke Foundations are going to be key components of the delivery of health at the community level, because we simply cannot afford the congestion in our hospital, the congestion of traditional out-clinic models that we all have everywhere in the context of social spacing. So I'll stop there because I can talk forever.
I mean, that was so hugely interesting and helpful to know. And I think, Maria, since you were talking about mental health earlier, and also about the kind of yawning gap in telehealth. I think like both awareness still and also more in access. Could you talk about kind of where you think not just mental health, but kind of healthcare broadly, maybe going in Puerto Rico, and also how people who may be listening may be able to help facilitate some of those changes with a real mind toward kind of quality and access, and then maybe Milagros, you can join in too.
Absolutely. And thank you for that presentation of what you're doing. I'm going to take away that word implementation marathon. And if I can just borrow it and put some energy behind it, that's exactly what we need to do, right? So in Puerto Rico for years now, our company's been working locally for 10 years. And we have been working on the implementation of evidence-based practices, particularly around the patient-centered medical home model. And it's focused on patient outcomes and the needs of patients. So as soon as the pandemic hit, we started contacting our federal partners, local partners to see what the real need was. And we realized that no one was really gauging what the patient's readiness was for telehealth, right? So we're focusing on technology and purchasing technology, but the technology is a tool, right? So the first thing that we did as part of our implementation, and something that I think is vital, I don't think this is specific to Puerto Rico. I think this is something that we have to take into account. How are we gauging patient readiness? And not just for telehealth, but readiness to stay healthy at home. So that's what you were mentioning, is just strikes to the point. And it needs to be done on a patient-by-patient basis. You can't treat every patient the same way. They're not the same way. A 65-year-old patient with multiple chronic diseases cannot be treated the same as you treat me or my son, right? So how do we then build out, right? Number one, the demand on the patient side, right? How do we strengthen that patient? I heard that community supports are vital. We're doing some work with community health workers on that space as well. And also, how do you work with patient organizations to provide both the support to onboard them to the platforms to make their houses appropriate for these interventions to keep them healthy at home, and also provide the support services to address their social conditions, right? And at the same time, so implementation marathon, right? We have to focus on how do we work on the supply side. So how are we actually working with our physicians and supporting our physicians and our hospitals so that they can make this huge jump? Because we're going from a system where, at least in Puerto Rico, almost everything was done in an office visit. Some things were done by phone. Now we're not just embedding technology. It's not about the face-to-face visit. It's about everything that goes around into making sure that that patient is ready for that visit, that their labs have been done, that that patient is completely ready for the visit, but also how do they follow up on that care, right? And that's not the way care is structured. So there has to be a lot of investment, not just in the IT side, which is where I see a lot of the investment going. A lot of it has to focus on technical assistance and support to physicians and clinics in restructuring those workflows, regulation, and financing. We really need to talk about the payment model so that physicians and providers are adequately reimbursed. And I know this is a U.S. national and an international discussion, so we'll keep on going at it until we get to it.
And I know we're out of time, but Milagros, I just wanted to ask if you had any final thoughts also on this kind of question of, telehealth if you want, but also just kind of how do you think COVID-19 may be changing healthcare in Puerto Rico, hopefully for the better going forward?
Yeah, we have been also using the telehealth strategy, but of course we have been facing a lot of challenges, and one of them is actually the lack of technology that people have. Even when we are living in Puerto Rico, which is the territory of the U.S., we find a lot of people do not have a computer. Just as simple as that. Even we conducted a survey at the Rio Piedras campus, and even college students, a percentage, like 20% of them do not have a computer. Amazingly so. and on top of that, people do not necessarily have internet facilities. Not everybody. We make all these assumptions that people have what they need, and then we find out that they don't, even just to begin the work. Uh, so I agree with Maria that we need to have um, investments in technology, investments in programs in order to people, to people to master the programs that need to go with the technology. But we also need to invest in promoting and educating people on the use of the technology. For young people to use the technology is very simple. And we find that younger people are very, friendly with the technology. But for adults, that's not the same case. And in my field, which is to provide therapeutic processes through telemedicine, is harder because people are not used to talking about their personal issues and problems and difficulties to a computer. So I would say that we need to work on the educational part of it as well.
Well, so clearly there is an extraordinary amount of work to do on kind of all of these challenges that we've just even touched on today. And yet I know we're all incredibly grateful for the work that you all are doing to help keep your communities healthy and safe, even in this perilous time that we are living kind of through. And just really want to urge everyone who has joined us this afternoon that if you are compelled by any of what you've heard, and I don't know how you could be anything but compelled, I hope that you'll reach out to these extraordinary women who are on the screen if you want to help support kind of their specific work, learn more about their specific work, learn how you can get engaged. And I hope that you will certainly let us know at the Clinton Foundation how we might help you kind of be more engaged and hopefully then stay engaged. And I just want to thank everyone at the CGI Action Network for helping facilitate our conversation today. I want to thank everyone who's joined us in conversation today, and I want to thank all of you for attending. And as ever these days, we hope that you stay safe. So thank you all very much.